Hi there, I'm Dr. Robin Chetkan, founder of the Digestive Center for Wellness. If you had told me 30 years ago when I was doing my medical training at Columbia or my gastroenterology fellowship at Mount Sinai, that I would be treating inflammatory bowel disease, Crohn's and ulcerative colitis with nutritional therapy, I literally would have laughed at you. But fast forward a few decades, and we've learned so much about what creates and drives immune dysregulation in autoimmune diseases like Crohn's and ulcerative colitis. And at the heart of that immune dysregulation is microbial disruption. So, of course, what you eat plays a huge role here. You have to make sure that you're eating the right foods that are supporting the growth of microbes that are actually helping to fight inflammation, and make sure that you're eliminating or reducing the foods that can promote the growth of microbes that are creating inflammation. But there are a lot of other factors that go into microbial disruption also. The medicine cabinet can be a huge source of microbial disruptors. Drugs like nonsteroidal anti-inflammatory drugs, antibiotics, acid blockers, hormonal therapy. There are lifestyle factors that play a role, sleep patterns, exercise, etc. So it's really important to put it all together to try and figure out where are things going wrong in terms of disease activity and what's driving the inflammation in your inflammatory bowel disease. And listen, I would be the first to tell you that I am thrilled that we have potent drugs out there like biologics and steroids and other immune modulating agents that are there for when people really need them. I myself prescribe these drugs as needed. But the truth is, there are a lot of people being put on these drugs as first-line therapy who don't really need them. Or there are people being left on the drugs, even when it's clear that they're not really working. And that's where we come in. About 3 out of every 4 patients who come to see us at the Digestive Center for Wellness are able to stop or decrease their immunosuppressive medication. And I'll tell you, there are very few things that give me more pleasure than getting people off of these drugs. Not because they don't work, they're amazing, but because of the side effects, because of the risk of infection and cancer and all the other things that can happen when you suppress somebody's immune system for prolonged periods of time. You may not be on one of these drugs. You may just be somebody with IBD who wants to know more about a food as medicine approach and is just curious about what that looks like. And if that's you, we are delighted to help. Knowledge, like food, is really powerful medicine, and I'm so delighted to share what I know and what I've learned over almost 3 decades of caring for people with inflammatory bowel disease. I am not here to sell you a supplement or a cure for IBD, just really good, clinically validated, scientifically backed, practical information that can help you feel better.